I'm here today to talk about medication-assisted treatment and why we at Sage Prairie use medication-assisted treatment. In general, in the past, addiction has been seen as sort of a moral failing or a loss of willpower. And if somebody just had enough willpower to stop drinking or to stop using drugs, then they could do it, or they had enough consequences, then they could do it. Well, we know a lot more about addiction now. We have a lot of studies that show that it's a chronic brain disease. It changes the way that your brain works. And it's a physiological problem within your brain. And so for every other physiological problem that we have within our body, we utilize chemicals or medications to help treat the physiological problem. And so when we use medications to treat addiction, we see it as using a medication to treat a disease, right? One of the biggest controversies within the addiction world or addiction treatment world is whether or not to use medications like Suboxone or methadone to treat opiate addiction. And the controversy lies within that Suboxone and methadone are opiates. So they are basically using the same sort of medication to treat what you're addicted to. It's the same thing, right? So how we see it is that it's not exactly the same thing. Specifically, Suboxone activates the receptors in a much different way than, say, heroin or other opiate pain pills. So it's not specifically the same. It doesn't have an endless tolerance. You can't keep using and using and using and using and using. It doesn't have a high with overdose risk. So even if you use way more than prescribed, there's a very low chance that you'll overdose, right? So, and then when you're using things like heroin or other opiate pain pills, there are other risks that come along with it, right? So there's the injection drug risk, there's risky behavior risks, there's criminal behavior risks. So when you go to a treatment center and you get on Suboxone, yeah, you might be activating the same receptors in your brain, but the symptoms or the behaviors are much different, right? So you're not doing those things in order to get the drug. So we see it as a little bit different than just replacing one drug for another. We see it as actual treatment of the disease. So when you're talking about using medication management to treat opiate addiction, the gold standard, meaning what we know works for the longest, is maintenance. And that means as long as we can, or forever. Most people don't want to be on these medicines forever. That's not their goal. And that's not necessarily my goal. My goal when I'm treating opiate addiction is to get people off of Suboxone when they're ready. So I see it as buying people time. So buying people time to do the work that they have to do so that they're not craving and they're not out trying to use drugs while they are doing the work that they have to do. And usually when I'm saying the work that they have to do, what I mean is they're treating their underlying depression. They're treating, if they have any sort of trauma history, they're understanding what that trauma is and working through it. And so they're treating their psychological symptoms while we're utilizing medications to help them not use drugs.